Good evening, all of you. Myself, Niharika. Please keep your camera on, everybody, for the introduction part of the yoga therapy. Everybody, for the connectivity part, it's mandatory that you have to keep your camera on. Everybody, for the brain part, just sit in any meditation posture, whatever you like. Just feel relaxed. Now, everybody, just sit in the Sukhasana posture or wherever you like you are sitting on the bed, on the chair. It's okay for that part. Now, close your eyes for the prayer part. Your elbow should be relaxed. Your shoulder should be relaxed.
Ma'am, the audio is not very clear. It is showing the sound.
Just a minute, just a minute.
And ma'am, it's
management.
for therapy class, right? Because the
Yeah.
heading says it's pregnancy yoga.
No, this is a therapy class, not an issue. Don't worry, ma'am. This is a therapy class, okay?
Yeah.
Okay, everybody, just avoid the unnecessary thing right now. We have to focus on the yoga therapy only, okay? So close your eyes softly. Everybody keep your mic on the mute mode. Now concentrate on your breathing. Take a deep inhale and deep exhale. Take a deep inhale and deep exhale. Just look towards your inside. Focus on your posture. Focus on your breathing. Is it fast or is it slow? Now all together, hands on the chest in the Pranam Mudra or the Namaskar Mudra for the prayer. Yogena Chittasya Tadena Vacham Nalam Sharirasya Chavedakena Yopakarotam Minam Tanena Patanjalim Pranjali Randosmi Om Shanti Shanti Shanti. Everybody all together rub your hands. Generate heat. Apply your energy on your face and eyes. Look in front of your palms firstly. Bow down to the Mother Earth and bow down to the Panch Mahabhutas for the therapy part, because our Panch Mahabhuta is our 5 elements for your body. Okay, myself is Niharika. I'm Niharika Jadeja and I'm the doctor in the naturopath and master in the Ashtanga and Hatha Yoga, right? So today is our introduction part and I'll explain to you what are the focusing on the yoga therapy, what is the therapy, what is the disease, what is the treatment of the various kind of the disease, some kind of physical, some kind of the mental. So यहाँ पर हम सबका पहला introduction लेंगे, okay? So you have to introduce yourself within your 2 or 3 lines. What's your qualification? What's your basic qualification? Like आपने कौन सा TTC किया है, ठीक है? So I'm starting from the Jyoti ma'am. Am I audible to you, ma'am?
Your voice is not at all clear, ma'am. The voice is lot of disturbance.
Your voice is breaking, ma'am.
Just wait for 1 minute.
Oh, yes, ma'am.
Okay. Just some kind of the network fluctuation at my place right now.
Okay.
Okay. So for the introduction part, I would like to Malaika ma'am just unmute yourself and give your introduction to us.
Hello.
Yeah, ma'am. Please give your introduction to us.
Yeah, myself Mallika. I'm basically from Karnataka, Mangalore.
Yeah.
So currently I live in Riyadh, Saudi Arabia. I done my
Okay.
MSW, Master in Social Work. So almost 8 to 9 years I worked as a HR in Bangalore. Then since 5 years I am at home with my kids. So
Okay.
during my free time, I get more students, yoga students over here. So last
Okay.
time I attended pranayama and meditation classes from Shubh Yoga. So
Oh, wow, very well.
now I thought to attend yoga therapy because I have many students coming over here.
Okay.
They are having some problems, spondylosis, some back pain, knee pain. So I thought this session will be more useful to me.
Okay. Welcome to Shubha Yoga. Welcome back, ma'am. Yeah. Okay.
Thank you
Yeah.
so much.
Just yeah, mute yourself. Just because
Yeah.
of the network fluctuation issue, I'm just मेरा camera मैंने अभी off रखा है, but after the 5 to 10 minutes, I'll put on my camera. Okay. Now, Jyoti ma'am, what about you? Just unmute yourself and give your introduction to us.
Hi, I'm Jyoti. I'm from Hyderabad. I'm a
Okay.
dentist. I have recently completed my RYT 200 yoga course.
Okay.
So to take it further, I thought therapy would be the better because a lot of those people who come to classes, they'll have some or the other ailment. So I thought yoga therapy would be the better further choice. I'm moving to US in another month. So I
Okay.
thought this would be another channel for me there.
Okay. It's a very nice film, ma'am. Welcome to Shubha Yoga Foundation. Thank you, ma'am.
Thank you. Thank you.
Okay. Yeah. Please, Sandhya ma'am, unmute yourself and give your introduction to us.
Yeah, my name is Sandhya. I'm a homemaker, and I was
Okay.
suffering from sciatica, back pain, everything. So yoga changed my life to overcome this pain a little bit, more than that. So I want to study this yoga therapy to help myself and my family members. If I'm able to do, society also. Thank you.
Okay. Very good, ma'am. Very good. And welcome to the Shubha Yoga. Okay. Vandana ma'am, just unmute yourself and give your introduction to us. What's your qualification and about that? Yeah.
Yes,
Hi.
ma'am, I'm facing some issue with camera somehow. I don't know. I'm not able to rectify it. I'll get it done by tomorrow. So
It's
first of
okay,
all, my
ma'am.
introduction is I'm master's in computer science and I have been working with various software industries last 17 years. I was
Okay.
in Walmart in United States, but was suffering with multiple health ailments like slip disc in my 6 cords, migraine every day, and all joint problems as a hereditary as well as my work profile was very hectic. So recently, due
Okay.
to all the culture and routine I was doing in United States, my health is degraded a lot. But since childhood, I do yoga and I'm very interested in that. Without surgery, I cured myself and started
Wow.
living normal life. So after my baby, as my health degraded more, I recently left my job and moved back to India to improve my health. So I thought I would focus instead of going back to IT. I would focus in my health path first, which will further help other people as well. So recently, I
Okay.
completed my 200 hours level 1, level 2 certification in yoga. And
Very
myself,
nice.
to cure myself and my family, I thought yoga therapy would be the next part for me. So I'm here for the and to do yoga. Thank you, ma'am.
Okay. Now would like to introduce like Divya ma'am. Just give your introduction to us. Divya ma'am, are you there? Just unmute yourself. Okay. What about the
Yes, can you
Preetna
hear me
ma'am?
now?
Yeah. Okay. Okay.
Okay, great. Thanks for
Yes.
giving me this opportunity. I have done my yoga 200 level course, completed graduation last year. I'm basically an entrepreneur. I run 2 digital businesses, but yoga has been my passion. It has really helped me through all my own health issues. So I've formalized all the learnings and now I've been teaching since the last 1 year. Along with the businesses, I'm also teaching to my society and online to all the colleagues and friends. So I wanted to advance this learning further and learn how to cure issues as well for the same students that I get and also my family members.
Okay, thank you, ma'am. So nice of you. So everybody knows about the disease and some kind of the mental for the physical and some kind disease of the spiritual part also, right? So for the yoga therapy is a very helpful course for your spiritual level, for your mental level, and for your physical level too. Okay. Now, Krishna, ma'am, just unmute yourself. Am I audible, ma'am? Are you there? Kritana, ma'am.
Yeah, my name is Kirtana. So I thought you are calling some other name, Krishna something. So my name is
yeah, definitely.
Yeah, Kirtana Srinivasan. I'm from Madurai, Tamil Nadu. So basically, I'm a mechanical engineer. So I was working in Ford IT in Chennai. Then after 2 kids, I just quit my job and I'm just full-time homemaker. And recently, like past 6 months before, I just did face yoga instructor course from Shubh Yoga Foundation. Then I have done 2 hours yoga teacher training course as well. And when I give some instructions for the even for the face, my students pain as well as the back pain. So I want to I want to give some instructions to my students like how they can cure from the yoga therapy like this.
Okay, now just mute yourself, ma'am. Thank you and welcome back to Shubha Yoga again. Yeah, thank you, ma'am. Welcome. Okay, now Unmesha, ma'am, also, are you there? Unmesha, ma'am. Yeah, please introduce yourself.
Hello, everyone. Myself, Unmesha. I'm from Maharashtra and I am Zumba instructor. Currently, I'm working in one yoga institute and I teach there Zumba. And I also want to start my yoga studio and Zumba studio. So along with that, I want to learn yoga therapy.
Okay, so nice of you, ma'am. Yeah, welcome, ma'am. Okay, now Priyanka, ma'am, are you there?
Hello, ma'am. Hello, everyone. My name is Priyanka. I am just about to complete my 200-hour TTC course, and I have learned the face yoga from Shubh Yoga Institute only. Now, while giving the classes to my students, they actually want, like they have a back pain, they have thyroid, so which yoga, which pose they should do. So like these questions they ask me in a regular interval of time. So to help them, I want to do this yoga therapy.
Okay, very nice, ma'am. Okay, now anybody remaining around? Okay, Olga ma'am or Olga sir, just unmute yourself and give your introduction to us.
Namaste everyone, my name is Olga. I'm a yoga teacher and lately I'm receiving a lot of questions about my students having some issues. They're asking me about that, so I have decided to learn yoga therapy as well.
Okay, now, so thank you, ma'am, for joining the Shubha Yoga Foundation. And everybody, thanks a lot. You are choosing the yoga therapy and Shubha Yoga Foundation. So everybody know about the yoga. What is the meaning of the yoga in our daily life routine or for our daily dincharya? You know about the dincharya? What is the dincharya? Your lifestyle. Just unmute yourself. One person.
Connection of your physical body with your soul. And reunited it with all the rules we follow.
Yes, very nice. Somebody else? Unmute yourself and
union.
Okay. So what about the union? Have you defined the union? Because yoga is only the physical posture and the pranayam and all that, but therapy is the such kind of the very different path.
So with breathing technique, we connect our internal organ along with the physical exercises.
Okay. Now anyone else? Divya ma'am? Unmesha
Yoga is,
ma'am.
ma'am, yoga is all about the physical, mental, and spiritual related. Like we have union of these all things, union of self with the universal cosmic
Okay.
energy.
Very nice, ma'am. Okay, so yoga is essentially a spiritual discipline based on your extremely subtle science, which focuses on bringing harmony between mind and your body. So it is an art and science for the healthy living. The word yoga is delivered from the Sanskrit root yuj, like join, like unite. Okay, but what is the yoga therapy? How you define the yoga therapy? Because we have to facing some disease in our body, like some kind of the back pain, sciatica, diarrhea, some kind of weakness, high BP, low BP. तो anyone अभी आप सब किसी को कुछ ना कुछ होता है for the woman wellness. अगर I'm asking about we have facing the some issue regarding the nervous system, anxiety, overthinking. So anybody knows about the anxiety level? What is the something? अगर आप anxiety level से जा रहे हो, right? तो फिर आपका nervous system वहां पर कैसे काम करता है? Because in the yoga therapy, we have to focus on the anatomy part, kinesiology, physiology. We are cover all part in the yoga therapy. So everybody know about the anatomy, kinesiology. Just unmute yourself and give me the answer regarding that. Unmesha ma'am, just unmute yourself. What do you know about the physiology of the body? What do you know about the kinesiology about the body? Because you are the Zumba instructor right now, okay?
If you are talking about anxiety and how body reacts on anxiety, actually, I'm going through depression last 5 years, and yoga helped me. Yoga helps me to come out from this situation. So our all body, we cannot explain. Actually, I cannot explain about this, but
it's okay.
I can say
it's okay, ma'am. It's okay, ma'am. Doesn't matter if you can't explain. But yoga therapy, if you are conduct the one-on-one session, or if you conduct the group session for the yoga therapy part, you have to know about the first of all your body, like your muscular system, your skeletal system, your nervous system, your digestive system, your respiratory system. Okay. So yoga therapy is an emerging field of the practice that use yoga to address the mental and physical problems while integration body and mind. Yoga therapy can be done one-on-one or in the group session with the people experiences similar problem, like आपने अभी जो डिस्कस किया depression, anxiety, like you have to facing since 5 years. Okay. So yoga therapy adopts the practice of yoga to the needs of people with specific or present health problems, either physical or mental in nature. Frequently, the students in yoga therapy programs need one-on-one attention, right? Yoga therapy can serve as a transition between individual instruction and a group instruction. People can benefit more quickly from a yoga program that is designed for their specific needs. Yoga therapy is the practical application of yoga principle for people with a special physical, emotional, or spiritual needs or challenges. So basically, I would like to introduce yoga in the general can help people both physical and mentally, because once a person is free of stress and the mind is focused and calm, the body can begin to heal itself. Any practice of yoga encourage help by the reducing stress, enhancing the concentration, stretching and strengthening the muscles of your body, increasing the feeling of comfort and bringing things back to balance. Yoga therapy simply focusing on the specific area of the needs and creates a yoga program that will meet that specific health of need, right? Yani agar aap concentrate karo, if the person want the strengthening in the thigh part, right? If the person facing the issue in that quad part, in the quadriceps, if the person facing the issue cramps in the quad parts, तो आप उस टाइम उसको कौन से योगा पोसेस फोकस करवाओगे, कौन से प्राणायाम उसको करवाओगे, राइट? कौन सी थेरापी उसको दोगे? तो योगा थेरापी इज लाइक ट्रीटमेंट विदाउट मेडिसिन. हम वहां पर मेडिसिन इंट्रोड्यूस नहीं करेंगे, राइट? जस्ट हम फोकस करेंगे पहले उसके फिजिकल and after that mental, after that environmental, after that cosmic and spiritual level. तो थेरापी each and every part पर आपका यहाँ पर वर्क करेगा, ठीक है? So yoga therapy is the use of the specific yoga practice to help people address specific health issues. Yoga therapy is prescribed the specific regimen like the postures, breathing, exercise and relaxation techniques to the suit individual needs. यानी हर किसी की जैसी नीड्स उसी तरीके से हमें यहाँ पर उनका जो शेड्यूल है वो फॉलो करना है. इफ यू कंडक्ट द 60-minute सेशन ऑफ योर क्लाइंट, तो रिगार्डिंग टिल 1 minute to 60 minutes, जब तक आपका क्लास स्टार्ट होता है और क्लास आपका जब कंप्लीट हो जाता है, हाउ यू ट्रीट योर पेशेंट, हाउ यू ट्रीट योर क्लाइंट, लाइक उसको कैसे आप रिलैक्स करवाते हो, कैसे उसको स्ट्रेंथ देते हो, कैसे उसको फोकसिंग पावर देते हो, नॉट ओनली ऑन द फिजिकल बेस, आपको उसके मेंटल हेल्थ और उसके स्पिरिचुअल लेवल तक आपको जाना होगा, ठीक है? लाइक अगर मैं बात करूं, सम पीपल इश्यू रिगार्डिंग द नॉट अबाउट द ओनली एंजाइटी, the person facing the issue regarding the gut health, right? But he or she hasn't stability. वो अगर योगा पोस्चर नहीं कर पाता, he or she can't perform yogasana as well as that time, what should we do? If the person can't practicing the yoga posture, if or she hasn't ability to perform the yogasana, if she or if he or she hasn't any power to perform the asana, तो उस टाइम पे आप क्या करोगे? What should we do that time? Any thoughts about that? अगर पर्सन योगासना पोस्चर नहीं कर पाता है ठीक से, तो उस टाइम पर हम क्या करेंगे? जस्ट से टू देम
मुद्रा करवा सकते हैं.
Yeah, definitely. Prana, we have to focus on your pranayama, mudra therapy. Yes, definitely. Okay, definitely. Chalo, one by one, start from the Malika ma'am.
Yeah, as someone said, mudra, then pranayama and meditation. So in meditation, we have so many form of meditations are there. So they can go for that.
Okay, thank you. What about you, Jyoti ma'am? What's your opinion regarding that issues? The person haven't any stability or strength? Just unmute yourself.
Yes.
What's your opinion?
Go with, pranayama, meditation, and relaxation might help them.
Okay. And what about the other? Because of you are the dentist ना, तो अगर आप अगर जानते हो कि जब like आप सर्जन हो और just medicine, your MD?
No.
Okay ma'am.
Graduation.
Okay ma'am. What about you, Vandana ma'am? What's your thoughts about that? If your client or some person didn't perform the asana, so what are you focusing on that? Which part?
What question exactly is, if they are not able to focus, what we should do, right?
The person he or she hasn't any strength or stability, but उसको आपको client को handle करना है, उसका case आपको tackle करना है. So how you focus?
Yeah. So if any of the posture they do not have flexibility or stamina, first thing is we should start with warm up, a very light warm up which includes all the joints of body. Doing
Yes.
warm-up will avoid the injuries while we do asanas, and it loosens up all the joint to perform asana in better position. So that is first
Okay.
thing. If they have any critical element where they cannot do any tough asanas or not even beginners asana, which was case for for myself, in that scenario, we will first jot down all the points, what exact health issues they are having, and we will find out those particular asanas only to start with to build their strength. Now, when we start with those asanas, there
Okay.
we need to
Hmm.
add modifications, because not each and every person can do same asan. Few people cannot do because of their flexibility or strength. So we can add variation, including knee pads or blocks, whatever
Okay.
there for their limitation. And with those, for first week or couple of week, we will increase only one by one asan, so that we will come to know which one are suiting to their body. If their body is reacting to particular asan, we will remove those asan and continue with the one which are suiting them, and try to gain more power or better posture in the same one over the period of time, and then we will add on as they build the strength.
Very good, ma'am. Very well explaining.
Thank you, ma'am.
Yeah. Okay. Now, what about you, Sandhya, ma'am? The person hasn't stability or strength regarding that posture. So, आप किस पर focus करोगे? What do?
Adding to these all steps, yoga nidra also help, I think.
Definitely, ma'am. Yoga nidra is very helpful in the yoga therapy. Because of the yoga therapy, आप जब postures, प्राणायामा, each and every part को जब आप complete कर लोगे तो like savasana और योग निद्रा वाला part last में आता है. If you have the more stretch or feel the more cramps while practicing, तो जब योग निद्रा और जब savasana वाला part आएगा तो आपके muscular system पर, आपकी nervous system पर, not only that part but आपका digestive system भी जो है यहाँ पर अच्छे से वर्क करेगा. बिकॉज ऑफ अगर आपका नर्वस सिस्टम ठीक से वर्क कर रहा है तो उसके साथ आपकी रेस्पिरेटरी सिस्टम अच्छे से वर्कआउट करेगी. एंड देन आफ्टर द रेस्पिरेटरी सिस्टम आपका सर्कुलेटरी सिस्टम ठीक से काम करेगा. इफ योर सर्कुलेटरी सिस्टम वर्क प्रॉपरली तो आपका गट हेल्थ, आपका डाइजेस्टिव सिस्टम अच्छे से वर्क करेगा. लाइक दिस इज द वन idioms in the Ayurveda and in the naturopath. लाइक कोई भी बीमारी जो स्टार्ट होती है हमारे पेट से होती है. ठीक है. ऑल काइंड ऑफ द डिजीज, सभी प्रकार की आदि व्याधि, आदि एंड व्याधि इज द डिजीज. ठीक है. डिजीज को हम संस्कृत में व्याधि बोलेंगे. आदि एंड व्याधि, द प्रॉब्लम ऑफ दी, कुछ भी आप लो, कोई भी आपको डिजीनेस फील हो रही है, इफ यू कांट फील बेटर, तो वो आपका कहाँ से स्टार्ट होता है? द स्टार्टिंग फ्रॉम योर गट हेल्थ. हर रोगों की जो जननी है इट्स योर गट हेल्थ, योर स्टमक पार्ट. आपका स्टमक पार्ट अगर ठीक से वर्क कर रहा है तो धीरे धीरे से डे बाय डे योर प्रैक्टिस ऑफ द योगा पोस्चर, योर हेल्दी लाइफस्टाइल, योर हैबिट of the healthy food like a sattvic or a rajasic. I'm not preferring the tamasic food at here. ठीक है. If you are the non-vegetarian, it's okay. If you are the vegetarian, it's okay. If you are the vegan, it's okay. If you follow the keto diet, it's okay. But for the ईटिंग पार्ट आपका गट हेल्थ बिगड़ना नहीं चाहिए, उस पर आपको फोकस करना है. ठीक है. तो दैट इज कॉल्ड द योगा थेरापी. योगा थेरापी आपकी फूड हैबिट्स पर भी वर्कआउट करेगी, आपके बॉडी पोस्चर पर, आपकी वॉकिंग पर, आपकी ब्रीथ पर, इन योर विजन, on your smile, on your face, on your shoulder, on your chest, on your stomach, on your thighs, on your barefoot, on your each and every part of your muscular system or the skeleton system. आपके बॉडी सिस्टम का कोई भी पार्ट उठा के ले लो, योगा थेरापी आपके हर पार्ट पर वर्क करती है. एंड व्हाट अबाउट द कॉस्मिक लेवल, व्हाट अबाउट द स्पिरिचुअल लेवल? द पर्सन शुड द फेसिंग रिगार्डिंग द लाइक उसके घर में कोई इश्यूज चल रहा है, उसका मेंटल हेल्थ भी ठीक है, सब कुछ ठीक है, बट सम काइंड ऑन द एक पॉइंट आता है उसको कुछ ठीक नहीं लग रहा है, तो आप क्या करोगे? उसका कॉस्मिक लेवल कैसे चेक करोगे? हाउ यू चेक द कॉस्मिक लेवल ऑफ द पर्सन? यू नो अबाउट द 7 चक्रास, एवरीबॉडी यू नो अबाउट द 7 चक्रास? अगर पर्सन का 7 चक्रास भी अगर इम्बैलेंस होता है, इफ योर रूट चक्रा इज इम्बैलेंस, अगर आपका रूट चक्र इम्बैलेंस होता है तो इसकी पहली इम्पैक्ट कहाँ पर आती है? यू नो अबाउट दैट एवरीबडी, because everybody know about some kind of the basic rules regarding the yoga only, okay? But therapy आपके 7 चक्रास को भी हील करने का काम करती है। अगर हमारा रूट चक्र इम्बैलेंस होता है, रूट चक्र कहाँ पर होता है? यू नो अबाउट दैट, वेयर इज योर रूट चक्र?
In between your vagina and
Okay, yeah,
perineum.
definitely. Yeah, Unmesha ma'am, just where is your root chakra? Just give me your answer in one line only. Okay, Divya ma'am.
Ma'am, at the lowermost part between the perineum and the lower spine.
So वहां पर कौन कौन से सिस्टम हमारे इम्पैक्ट करते हैं रिगार्डिंग आपका अगर रूट चक्र है? रूट चक्र इज नियर बाय योर pelvic bone, your pelvic region, right? And that part is our Kegel part, our vaginal part. तो वहां पर कौन कौन से सिस्टम्स होते हैं, कौन से सिस्टम कंबाइंड होते हैं? Like I want to
how about your excretory
Yes,
system?
ma'am, small intestine, large intestine वहाँ पे
yeah, but
कनेक्ट होते हैं।
वो ओके, स्मॉल इंटेस्टाइन एंड लार्ज इंटेस्टाइन, सो वो कौन से सिस्टम में होते हैं?
डाइजेस्टिव सिस्टम।
वेरी गुड। और डाइजेस्टिव सिस्टम जो है वो किस पर फोकस करता है सबसे ज्यादा?
मणिपुर चक्र।
नो,
ऑर्गन्स में मैम।
देखो मैंने अभी जो बात की है वेरी से रूट चक्र, या आपका जो रूट चक्र है वहां पर कौन कौन से सिस्टम जो है वो इंक्लूड होते हैं, मर्ज होते हैं। देयर आर द 3 सिस्टम, यू नो अबाउट दैट। आपने रिप्रोडक्टिव जो बोला, ठीक है, डाइजेस्टिव भी बोला, बट व्हाट अबाउट अदर? आपके बॉडी के टॉक्सिन्स पार्ट जो होते हैं ना, यू नो अबाउट द टॉक्सिन्स पार्ट्स ऑफ द बॉडी।
Excretion process.
Discretion of stock.
डेफिनेटली, बिकॉज अगर आप अपना यूरिन पास करते हो, आपका जो स्टूल आप पास करते हो, आपका पॉटी पास करते हो, वो कहाँ पर आता है? दैट्स योर टॉक्सिन पार्ट, वहां से वो पास होता है, ठीक है। सो फॉर द योगा थेरेपी इज द application of the yoga practice to elevate the physical and mental health conditions with the view of promoting self care and encouraging all over well-being. अगर मैं यहाँ पर अगर सबसे ज्यादा बात करूं तो जब आप योगा करते हो फॉर योर योगा पोस्चर्स, तो योगा आपको क्या प्रोवाइड करता है?
Stability.
योगा आपको प्रोवाइड करता है, यस। एंड व्हाट अबाउट अदर्स?
Balance.
वन बाय वन आप सब अनम्यूट करते जाओ, गिव मी द आंसर रिगार्डिंग दैट। योगा कैन हेल्प पीपल हील, बट इन which ways?
It improves our immunity system.
Okay.
It also helps them with good lifestyle habits.
Definitely. What about the others? There are various kind of the benefits in the yoga. This is the only 1 or 2, 3.
If we combine it with pranayam, it helps us in mindful breathing, which we do not do in tattoo.
Okay, very good. So yoga can help people heal in the following ways, like increasing the flexibility, strengthening in the muscles, improve balance, improve immune system, improve immune function. You know about the immune function? Like हमारा इम्यूनिटी तो अच्छे से वर्क कर रहा है, बट अगर इम्यूनिटी हमें खुद खा जाता है तो वहां पर भी डिजीज आता है। यू नो अबाउट द इम्यून डिजीज, ऑटो इम्यून डिजीज?
Yes, ma'am. SLE, arthritis, rheumatoid arthritis.
डेफिनेटली मैम, वहां पर इम्यून सिस्टम हमें खुद खा जाता है, ठीक है। तो हम कितना भी मेंटेन करेंगे इम्यून सिस्टम को, बट फॉर द आर्थराइटिस एंड फॉर द अदर काइंड ऑफ द लिपिड, यू नो अबाउट द लिपिड प्रोफाइल, यूरिक एसिड एंड ऑल दैट,
Yes,
ये
ma'am.
सारा जो आता है ना, या ये सारा जो पार्ट आता है वो आर्थराइटिस में आता है। कितना भी आप एंटीबायोटिक ले लो, कुछ भी ले लो, कितना भी आप एज पर द आयुर्वेदा, अगर आपने हेल्दी लाइफस्टाइल को फॉलो नहीं किया, अगर आपने हेल्दी हैबिचुअल टाइम टू टाइम शेड्यूल फॉलो नहीं किया, कुछ भी अच्छा खा लो, बट वो ठीक से काम नहीं करता है, तो जहां पर मेडिसिन अटक जाती है सम काइंड इन सच डिजीज, तो वहां से योगा थेरेपी अपना वर्क करना स्टार्ट कर देती है, ठीक है। सो एंड व्हाट अबाउट द अदर पोस्चर, लाइक इम्यून फंक्शन पर तो काम करता ही है योगा, बट improves for the posture, improvement for the lung function, joint health, improves the function of the feet, strengthening the bones, promote weight loss. You know about the weight loss, inch loss and all that. ये भी योगा थेरेपी में आता है, ठीक है. लाइक प्रमोट्स लाइक नर्वस सिस्टम, वहां पर हमारी अच्छे से रिलैक्स होती है. इम्प्रूव द फंक्शन ऑफ द ब्रेन फंक्शन. यू नो अबाउट द ब्रेन फंक्शन, हाउ टू कैसे करेंगे उसको, ब्रेन फंक्शन को कैसे हम फॉलो करते हैं. अगर किसी को ब्रेन के रिगार्डिंग इश्यू है, लाइक ब्रेन ठीक से वर्क नहीं करता है, सम काइंड ऑफ दी कुछ अल्जाइमर लगा है. यू नो अबाउट द अल्जाइमर, ऑल ऑफ यू. अल्जाइमर इज द डिजीज रिगार्डिंग द ब्रेन फंक्शन, ठीक है. तो वहां पर क्या करवाते हैं हम फॉर द अल्जाइमर?
We will start with relaxation technique and do all pranayam like Bhramari and all, which relaxes brain.
वेरी गुड. बिकॉज आपका जो ब्रेन सिस्टम है आपके नर्वस सिस्टम पर सबसे बड़ा इम्पैक्ट करता है. यू नो अबाउट 72,000 वेन्स इन अवर बॉडी. वो कहाँ से आती है और कहाँ से जाती है? आपके ब्रेन पार्ट से वो स्टार्ट होती है और आपके बैर फुट तक फैली होती है. और उसमें सबसे ज्यादा इम्पैक्ट कहाँ पर होती है? या ओके मैम. यू नो अबाउट दी अवर नर्वस सिस्टम, जो कहाँ से स्टार्ट होती है और कहाँ से कंप्लीट करती है. Just someone unmute yourself and give the answer regarding that.
मैम ये 72,000 नाड़ियां हमारे ईच चक्रा से स्टार्ट होती हैं, फिर उनके फर्दर और डिवाइड होती चली जाती हैं वो.
Okay. So कौन सा बोन्स वहां पर कनेक्ट होता है? Which bones to connect your brain and your lower limb?
स्पाइनल कॉर्ड.
Voice is breaking.
And what about the other? Spinal cord किसको कनेक्ट करता है?
स्कल को, पूरे स्पाइन को.
Very good, ma'am. So yoga therapy helps in the lower blood pressure, improves the bowel function, relieves the pain regarding the muscular system, improve the physiological health, leads to healthier habits, encourage the involvement in own healing. आप अपनी खुद की भी healing कर सकते हो. You know about the healing part for the your spiritual level, for your physical level. Healing part कहाँ पर दिया जाता है? Anybody? You know about the healing part, how to heal your client, how to heal your person, your kids in your family. If the person facing the issue, some kind of the pain in this, some partial pain. You know about the partial pain? Jyoti ma'am, how you define the partial pain? आपके पूरे बॉडी में नहीं होता है, स्पेसिफिक इन वन काइंड ऑफ द मस्कुलर, लाइक सम काइंड ऑफ द सम इन द वेन. पार्शियल पेन पूरे बॉडी में नहीं होता है, सिर्फ एक ही पार्ट पर होता है. जस्ट थिंक अबाउट दैट. दिस इज द योगा थेरेपी. आपको यहाँ पर क्लाइंट का टॉप टू बॉटम देखना पड़ेगा. फर्स्ट ऑफ ऑल योर इन द योगा थेरेपी क्लास, मेक योर आईज एज अ स्कैनर. Make your eyes as a scanner and look towards your client from top to bottom and define, prescribe, escalate to client how he feel, how she feel, how he eat, how she eat, how he react, how she react in the class with you. ठीक है. आपको जेनेटिकल पार्ट पर भी पूरा हिस्ट्री उसका चेक करना पड़ेगा. You know about that? So some of the specific health conditions that have been shown by scientific studies to be helped by yoga include alcoholism. अगर कोई person alcohol लेता है, if the person the habitual of the alcohol, तो वहां पर उसका ड्रग अब्यूज होता है, तो वहां पर भी उसकी जो आदत है हम छुड़ा सकते हैं by the yoga therapy. If the person like some alcoholism, तो आप उसको कैसे करवाओगे, उसको कैसे निकालोगे? You know about that? योगा थेरेपी वहां पर भी काम करता है. एनीबडी नो अबाउट दैट? द पर्सन वो काफी अल्कोहल लेता है, अगर उसको छुड़ाना है तो आप कैसे काम करोगे उस पर? ऐसे भी केसेस आते हैं योगा थेरेपी. पार्ट यस. कृथाना मैम, आर यू देयर? ज्योति मैम, Palika ma'am, are you there? Everybody? if the person intake more alcohol, right? ऐसा भी cases yoga therapy में आता है. Okay, not an issue. If the person facing the issue regarding the asthma, you know about the asthma, this is the disease regarding the respiratory system. Okay, और आपको अस्थमा के रिगार्डिंग अगर उसको केसेस आपको सॉल्व करने हैं तो which pranayama helpful in the asthma part? You know about that? Divya ma'am, you know about the asthma? Sandhya ma'am?
Nadisuri pranayama.
Okay. So which pranayama helpful in the asthma, anxiety, depression? This is a disease regarding the respiratory system, your nervous system. Everybody, why you are mute?
Kapalbhati should also help because alcohol makes your lungs weak and Kapalbhati makes your lungs stronger, and it is
Very good,
also
ma'am.
helps in respiratory system.
Very good, ma'am. Very good. So, yoga therapy is not a work on only on the drug abuse. It is work on the anxiety, asthma, attention deficit disorder, carpal tunnel syndrome. You know about the carpal tunnel? You know about the barefoot? Carpal वाला जो part होता है ना, in your barefoot part. अगर वहां पर कोई syndrome है, वहां पर if you pain in your barefoot, if you have the pain in your leg part, तो वहां पर ये syndrome वाला part होता है. The yoga therapy is the work on the depression, diabetes, eating disorder, epilepsy, heart disease, high blood pressure, insomnia. You know about the insomnia? Everybody?
Yes.
This is a sleeping issue. Yeah, very good. Sir, I can't hear your voice properly. Please explain about that.
Sleeping issues, ma'am. Lack of sleep.
Okay.
For me.
So insomnia is the disease of the lacking of the sleeping, right? And after that, insomnia, the therapy is also helpful in the irritable bowel syndrome, menopause, PCOS, PCOD, infertility, headache, your chronic pain, your pregnancy like prenatal and postnatal, right? Scoliosis, sinusitis. You know about the sinusitis? Everybody? This is the disease. Sinusitis कहाँ पर होता है? Know about that? Where is the sinusitis?
Nearby nostrils, where you get a small bone which is going increasing towards your brain. There are different kind of. A few people are sneezing in the morning with little dust or just fan. Few people just continue sneezing after change of weather or just with the sunlight. When they go into sunlight, they start sneezing, or with pollen.
Yes.
All these different kind of sinusitis they have. Some have running nose. Some have just headache due to sinusitis and all those kind.
Okay, ma'am, very good. What's your name, ma'am? Just on your screen is show the Galaxy S10 only.
Oh, sorry, Vandana, because my camera was not working, so I turned on my mobile to join.
Okay, are you Vandana, ma'am?
Change my name. Yes, ma'am. I'll change my name.
Okay, ma'am. Okay, very good, ma'am. So for the yoga therapy is the application of the yoga practice to elevate the physical and mental health condition with the view of the promoting self-care and encouraging overall well-being. अगर मैं बात करूं तो yoga therapies align the unique and precise health needs of the client with the yoga practice, which the yoga tradition and also medical science find have particular curative efforts. For example, with the lower back pain, there are very specific yoga position and posture for the strengthening and supporting the back, even soothing the symptoms of the herniated disc. Likewise, with the post-traumatic stress disorder, PTSD, there are gentle specialized ways to regulating the nervous system and fostering the return of an awareness of the body. Specific yoga posture can also help to used in the reduce heighten the sensory and promote the emotional regulation with the autistic clients. Session may include the breathing techniques, posture, meditation, relaxation, techniques or the promotion of the behavioral changes. If the person facing regarding the autism, you know about the autism, everybody?
Yes, ma'am.
या ऑटिज्म जो होता है छोटे बच्चों में सबसे ज्यादा होता है. दिस इज द डिजीज रिगार्डिंग द नर्वस सिस्टम. अगर बच्चा आता है, अगर उसको कुछ फील नहीं होता है, लाइक the kid or the toddler facing the issue regarding this eye problem, if or she has physical condition उसका traumatic है, तो वहां पर उसको autism लग जाता है. Who knows about the autism? Everybody, just mute yourself and say yes, Vandana ma'am.
Yes, ma'am. Autism, there are different types, like percent of autism. Like few kids are born with autism. They do not even like to get touched by their mother, even at the time of breastfeeding. Those kids, when they are detected as autism kid, they needs to be fed with injections and all. Their mother do not even touch. Some percent, like some kids, they like to get touch or hugs and kisses from their parents, but they are very scared from outsiders. And with their parents also, sometimes they are just touching when they are willing to. Otherwise, they are not, like 70 or 90%, that kind of autism I'm aware of. But I have one question: is it treatable by yoga?
Yeah, definitely. Autism is treated by yoga, but not only for the 100%. वो 50 to 60% जो है autism को क्योर कर देता है, ठीक है. But it is a very long process. Like client को हमें 3 to 5 years तक अच्छे से ट्रीट करना पड़ेगा. But because yoga therapy is not a fast treatment. This is take like 1 year or 2 year for the autism and for the Parkinson issues. Okay. You know about the Parkinson क्या होता है? You know about it?
No, ma'am.
Sandhya ma'am, Divya ma'am. See, this is our, there are very disease in our.
I don't know actually medical this thing, but we can't hold anything. Hands are shivering like that. I have seen, but I don't know exact medical explanation.
Okay. So Parkinson, this is the disease regarding the nervous system और आपका जो muscular system है ना, उस पर ये depend करता है. तो for the yoga therapy part, you have to study more and more anatomy. जितना आप anatomy पर focus करोगे, उतना ही आप यहाँ पर disease को check कर पाओगे. Okay. Now for
Is
the
it denervation, ma'am?
Yeah, definitely. थोड़ा सा बोल सकते हो उसको. I want to ask to like we are the female, right? अगर मैं बात करूं the issues regarding the menopause and pre-menopause, what do you know about that? Pre-mono and menopause.
Ma'am, I can talk
So-
about that. I have gone through a lot of these issues myself, and that is the main reason why yoga has helped me from infertility, early menopause, perimenopause, all of that.
Okay, ma'am. So just give me a 2 or 3 lines for the pre-mono. Pre-mono पे just explain कर पाओगे right now?
Ma'am, your periods, it starts when your periods start becoming irregular, or you have mood swings or hot flashes, a lot of different hormonal changes in your body.
Very good, ma'am. Okay. Now it is the preconception part of the pre-mono. And what about the menopause? What about Jyoti ma'am? Okay, mute yourself, ma'am. What about the menopause part, ma'am?
Menopause is the time when the periods completely goes away, where they'll have lot of hormonal imbalances, hot flushes,
Yes.
lot of headaches,
Okay.
body, lot of completely up and down.
Yeah, it's depend on our hormonal changes or hormonal imbalance. Okay. Yes, ma'am. Sandhya ma'am or Divya ma'am, just unmute yourself and just give the opinion regarding the pre-mono and menopause or infertility, whatever you like. Okay, Vandana ma'am. So Bharat sir, are you there? After the Bharat sir,
Yes.
yeah.
Yes, Bharat sir. Please go.
Ji. Bharat sir, are you there?
No, miss, ma'am.
Yeah.
Okay.
No idea.
Okay, not an issue, ma'am. Yes, ma'am. Vandana ma'am, just explain about the menopause.
So menopause, like different age, girls are getting their periods start same way. At different age, their periods are going away completely. but before it goes away, they see multiple hormonal changes as well as different issues with their regular periods. And it gives lots of health issues, mood swings, and different problems with their health, which we do not understand why it is because of menopause, but we continue figuring out with other health issues, and later we come to know like it is menopause, which we can balance through yoga.
Okay, ma'am. Very good. Thank you. Olga, ma'am, are you there? Just give your opinion
Yes.
regarding the infertility.
I think it's a hormonal disbalance in some specific age. Women stop receiving estrogen and testosterone against some specific hormones. I'm not sure which one, but the body stops produce this kind of woman hormones.
Okay, very good, ma'am. Okay, now what do you know about the PCOS and PCOD? What is the symptoms of the PCOD? Like in the early age, like a girl is the 13 or 14, and that time she facing the PCOS and PCOD, but usko period aa raha hai, irregular period, but she is facing for the PCOS and PCOD. What she feel that time in the early age, 13 and 14? Have you handled that case that time for the teenager? Because therapy is not only on the senior citizen, it's for the toddler, for the 7 to 10 years, for the 11 to 15, 50 to 20, यानी सारी एज पर yoga therapy work करता है. Okay, so I would like to Unmesha ma'am, are you there?
Yes.
Unmesha ma'am, yeah, just give your opinion regarding the early age period or PCOS or PCOD, if you know about that.
Sorry, I don't have any idea.
Okay, not an issue, ma'am. Anybody? Just unmute yourself and give your opinion regarding the irregular period.
Due to
Yeah,
a
definitely,
lot
ma'am.
of changes in the lifestyle of the kids, especially adulterated milk, steroids,
Yes.
a lot of things are changing, a lot of hormonal imbalances in the kids because all the food what they eat are adulterated. A lot, especially milk, the packaged foods, frozen foods, all the lifestyle changes are leading to all these.
Okay, definitely, ma'am. Let's work on that. Some disease, PCOS and PCOS. Yes, Vandana, ma'am.
Yes.
Thank you, ma'am.
Ma'am, due to irregular period, females usually goes through different kind of ovary diseases like cyst or any other diseases which do not allow them to conceive naturally or
Okay.
getting their periods naturally. Either they need to take medicine to get their periods if their period cycle is not in between 28 to 30 days, kind of, they need to get medicine to regulate their periods, or their flow is more than the regular, or their cycle is elongated. It's like 15 or 20 days. Due to all those issues in their periods, they are having ovary diseases which do not let them conceive. So it affects their reproductive system, which we can through Malasana and all kind of different asanas which are for hamstring and pelvic area, which cures this
Yes.
PCOD and PCOD.
You know very well about the whole anatomy part and all, with some specific cases. Very good, ma'am. You have very good knowledge regarding that.
Thank you, ma'am.
Yeah.
But I am not from bio background, just because of passion. I keep
Not an issue, but if you are the practicing yogasana and if you आपने TTC किया हुआ है, some kind of the 200 or any such kind of the yoga training teaching course, तो आपको ये सब आना ही चाहिए, ठीक है? अगर आपको नहीं आता है तो not an issue, while for the TTC part हम ये पूरा cover करेंगे, ठीक है? Thank you, ma'am. Thank you so much. Yes, Malika ma'am, are you there? So what is your opinion about the infertility and early age menstruation for the 12 or 13 years girls? किसी को 10 years में भी आ जाता है periods, regarding that the habitual food उसकी habit अच्छी नहीं है तो भी उसको जल्दी से आ जाता है, तो उस टाइम पे आप क्या करोगे? How to handle that case in the early age period?
Actually, I personally, I myself suffered from PCOS, so I went for yoga. courses. So I had lot of experience, like PCOS experience.
Just can you share with your
Like
experience?
hormone imbalance,
Okay.
and it's because of lifestyle, food style, stress.
Okay.
And sometimes
nice.
it's like a hereditary, it's not exactly, I can say hereditary, but I feel it matters, even hereditary also, if her mother gets the Pires problem. So definitely it transfer to her child.
Okay, very good, ma'am. You have the facing issue regarding the PCOS, but
I suffered a lot and
it's a
lot.
very this is a
But now
very
I am very healthy, like regularized my periods. So continuously
Okay.
I'm practicing yoga, pranayama, meditation, and
Very
even
nice.
my lifestyle also I changed. I was into corporate life. Now my
Okay.
lifestyle, food style, everything is changed. So
Very good, ma'am. Ma'am, can I ask you something regarding your lifestyle? Have you maintained your lifestyle from the wake up time to sleeping time? Malaika, ma'am. Malika, ma'am, are you there? Am I audible to you?
yeah. Sorry, one for my
Yeah.
kid.
So, have you managed your daily lifestyle?
I start my like morning. I all family stuffs and all. Then I practice 2 hours yoga and half an hour pranayam and meditation. And I cut down all masala items, cut off all my masala items, food. And I'm from coastal area. I love to eat fish, but I only prefer curry rather than fry items. Then almost 95% I skipped chicken items. Then all
very
outside
nice.
food. All
You are
outside
avoiding
food.
the Rajasic ahar, na?
Sorry. Yeah, yes.
Yes, non-veg is still like the tamasic and some kind of the Rajasic ahar. You know about that? We have the food in the divided in the 3 parts. The first is the sattvic, second is the Rajasic, and the third is the tamasic. So yoga and yoga therapies depend on the food therapy. Because of यहाँ पर हम आपको योगा डाइट भी प्रोवाइड करेंगे थोड़ा सा लाइक सम फूड हैबिट्स जो होता है ना किसी डिजीज में आपके पर्टिकुलर टाइम पर वो आपका काम भी करता है बिकॉज आई एक्सप्लेन बिफोर सम टाइम कि आपका जो पेट है सारे डिजीज का क्या है मदर वहां से ही जो सब कुछ होता है वहां से ही निकलता है और वहीं से सब जो है वो ठीक हो जाता है यू नो अबाउट द टॉक्सिसिटी देयर आर मेनी टॉक्सिसिटी इन आवर स्टमक पार्ट हाउ यू डिफाइन दैट टॉक्सिसिटी पार्ट हर रोज होता है हमारे पास तो आप कैसे फील करते हो इसको इफ यू हैव द इशू रिगार्डिंग द एसिडिटी बर्प्स like your vata pitta and kapha are dominate that time or for the particular time and about the 3 doshas we have the 3 doshas gunas in our lifestyle everybody so
like I prefer to have jeera water, cumin seeds water daily.
Okay. Yes.
And then I don't know what they're calling ash pumpkin juice.
Very good.
Ash pumpkin and gooseberry juice.
This is the silver juice. Ash ना white वाला juice होता है थोड़ा सा grey color का उसका.
That is pumpkin. White pumpkin. Then Loki.
Okay, very good, ma'am. Okay, ma'am. Thank you for your sharing your experience. Thank you so much, ma'am. Yeah, just yes, ma'am. Ma'am.
So, ma'am, depending on season and vata or of dosha of your body type, like if suppose you are having vata body or kapha body will not tolerate curd, banana, all kind of food after 4 p.m. or early in the morning. So depending on we should have if it is winter, we should have dry fruits. As I am pure vegetarian, I manage it that
Okay.
way. All soaked dry fruit and all lentils where we have removed all gas. We soak them overnight, and that way we manage it for protein supplement and all. If you have pitta body where you cannot have sour food, empty stomach in the morning, so that way you
Yes.
need to use ragi as a breakfast, or in morning your agni jatragni is low, so you need to have a warm breakfast. Your timing of meal should be fixed. Your sleeping pattern should be fixed. It is not like sometimes you sleep early, sometimes it also affect dosha in your body,
Yeah.
like acid reflux and all those stuff. So those all things I manage personally because I suffer from migraine a lot. And another
Okay.
thing which is affecting these days, like electronic devices, I put on reminders in all my apps. Like if we keep on watching TikTok or Reels, then there should be some timer. We should keep our phone aside, and before we sleep, 1 or 2 hours before, we should keep phone in another room, because our brain takes another 1 hour after we switch off all electronic devices, TV, television, laptops, so that it will prepare himself that we are going to sleep after 1 hour. And that way we need to maintain our body cycle. Along with that, like abhyanga and all those things in the morning, which helps a lot with all those cycles.
Very good. Abhyangam is the also part of the yoga therapy. Abhyangam is the massage, some specific partial massage on your shoulder, on your back, on your barefoot, on your head part too. You know about the Abhyangam? Abhyangam is the Sanskrit word. And massage आपको some part पे अगर pain है, if you have the pain in your bicep and your tricep, or if you have the some sesame oil on the particular part of the bicep and tricep, आपका ये जो पेन है वो भी by the massage part and by the acupressure point आपका remove हो जाता है. Okay, so such a very session with you and such a beautiful talk with you, all of you, every people. आपके साथ आज का इंट्रोडक्शन पार्ट जो है वो बहुत ही अच्छे से रहा. Just आई एम फेसिंग सम फ्लक्चुएशन इश्यू रिगार्डिंग द नेटवर्क. मेरा कैमरा मुझे ऑफ रखना पड़ा, so sorry for that. From tomorrow sharp 8 to 9 we have to conduct a 60-minute session regarding the yoga therapy part. Okay, so see you tomorrow same time. Okay, everybody, for the closing ceremony prayer, just sit on the any posture whatever you like.
I'm sorry
Just
to interrupt. Is this only theoretical session throughout the month, or we
no
will
no
be
no
doing
no
class as well?
no we have to go for the theoretical and practical part also. Don't worry ma'am. ठीक है?
Ma'am, you will send the note today. Note today section.
Sorry?
Notes you will send today. Notes. Today's section notes.
Yeah,
PDF.
definitely. We'll provide the PDF and all that kind of the study material in the group as well as. Okay, don't worry, sir.
मैम आपने
Okay,
पार्शियल
everybody.
पेन के बारे में बताया था, वो क्या होता है?
Partial pain is like regarding I have the practicing the Veerbhadrasana and Warrior 1 and Warrior 2, and while the practicing I raise your hand like that. But if I have not strengthening in my bicep and tricep, that time कुछ पर्टिकुलर पार्ट के लिए 1 or 2 minutes के लिए मुझे यहाँ पर क्रैम्प्स आ जाता है. Some kind of the less water intake that time, or if I have the high BP issue, or if you I have the issue some regarding the lower BP, कभी कभी हमें हो जाता है. तो यहाँ पर हमें कुछ कुछ टाइम के लिए पेन आ जाता है, फॉर द नॉट लॉन्ग टाइम, शॉर्ट टाइम के लिए. दैट टाइम यू अप्लाइड द सेसमे ऑयल और मस्टर्ड ऑयल ऑन दैट पार्ट. बट ये आपका सीजन पे आपका अकॉर्डिंग करेगा. इफ आई एम प्रैक्टिसिंग इन द विंटर पार्ट, तो सेसमे ऑयल. एंड फॉर द other season, which kind of the season? We have the 3 season, right? You know about all that season: monsoon, winter and summer. तो in the ठंडी वाला सीजन में हम सेसम ऑयल यूज करेंगे, एंड फॉर द गर्मी वाला पार्ट वी गो फॉर द कोकोनट ऑयल. उस टाइम पे कोकोनट ऑयल को यूज करेंगे, बिकॉज ऑफ कोकोनट हैज द सूदिंग पार्ट. तो हमें जैसे जैसे हम थोड़ा सा रबिंग करेंगे फॉर द द सर्कुलेटरी पार्ट, एंड थोड़ा सा उसका एक्यूप्रेशर पॉइंट, तो तो आपका विद इन 1 or 2 hours आपका जो पेन है वो थोड़ा सा चला जाएगा. पार्शियल पेन इज नॉट अ लॉन्ग टाइम इश्यू, वो थोड़े शॉर्ट टाइम के लिए होता है, लाइक 48 hours और 72 hours. जैसे जैसे आप स्ट्रेचिंग पार्ट पर फोकस करोगे, आपका जो डिजीज पार्ट होता है, सम पार्शियल पेन और सम काइंड ऑफ दी हेडेक, लाइक थोड़ा सा माइनर हेडेक है, तो हम एक्यूप्रेशर पॉइंट से वाइल द अभ्यंगम, वाइल द मसाज पार्ट भी उसको हम क्योर कर सकते हैं. ठीक है.
Okay, ma'am. Thank you, ma'am.
या वेलकम मैम.
Acupressure points is also part of this course, right?
या डेफिनेटली जो बेसिक वाला एक्यूप्रेशर पॉइंट होगा वो आपको यहाँ पर सिखाया जाएगा. डोंट वरी मैम. ठीक है. So everybody, just softly close your eye for closing part. We have to perform the closing prayer at here.
Doubt, ma'am. Today you
Yes,
said
please,
about
sir.
conditions, ma'am. For that condition, what are the asanas? What are the pranayama we need to do? That notes and all will you ma'am.
Every सारे PDF में, सारे materials में सब कुछ mention किया जाएगा. Each and every disease regarding the nervous system, skeleton, muscular, जो भी disease यहाँ पर आपको सिखाएंगे, do and don'ts, pros and cons, सब कुछ आपको maintain मिलेगा इस study material में. ठीक है.
You said about only conditions and what kind of condition, but what we can do, that one you are not said. So that's why I asked you.
No, sir, ये तो सिर्फ इंट्रोडक्शन था. That's why I'm just picking some kind of issue जो डेली लाइफ में हमें होता है, या फिर if I conduct the one-on-one session, if I conduct the group session, हर किसी को सेम प्रॉब्लम नहीं होता है, तो मैंने थोड़ा सा पर्टिकुलर डिजीज को यहाँ पर पिक किया था. राइट सर.
Okay, yes ma'am. Okay.
Okay, thank you, sir.
Thank you, ma'am.
Thank you, sir. Yeah. So everybody just close your eyes. Your shoulders should be relaxed. Your elbow should be relaxed. And focus on your breathing. How you feel inside today? Loka samasta sukhino bhavantu. Om shanti, shanti, shanti. All together, rub your hands. Generate heat. Apply your energy on your face and eyes. Softly open your eyes and go down to the Mother Earth. Thank you for joining my class, everybody. See you tomorrow, same time. Okay. Hari Om for today.
Thank you.
Bye, everybody. Yeah. Good night.
Thank you, ma'am.